Alright, so we're going to be checking cranial nerves 1 through to 12 today. And we're going to start with cranial nerve number 1, which is your olfactory nerve, which innervates your sense of smell just here. So what I'm going to do to begin with is I'm just going to check the symmetry of your nose. Yeah. And if you tilt your head back just a little bit, I'm going to check for any blockages. And no, you are good to go. Okay, so let's just check your sense of smell. So I have here a very strong smell, which if you plug up this nostril here for me, I'm going to get you to tell me what the smell is. Okay, so if I just hold that up to your nose, yeah, peppermint, good, that's fine. Now if you can block up the other nostril for me, that is perfect. And same thing with the other nostril, tell me what that smells like. Yeah, coffee, good, that's great. Your sense of smell, they say, is the strongest. It's associated with your memories. So sometimes if, for example, you walked into a house and you smelled paint, drying paint, that might take you back to a time in your childhood when perhaps you were playing with paint as a child, or your parents were painting a room or something. And the reason for that is that the olfactory nerve ends in the hippocampus in the brain, and the amygdala at the back here, which are most strongly associated areas of your brain for memory. So not a lot of people know that. So okay, what we'll do next is we'll move on to the optic nerve, which is responsible for your sight. So what I'm going to do to begin with, we're going to check your field of view. Now this is just a very rough measurement, but I'll get you to just look at the bridge of my nose just here and not moving your head. If you can keep your head as straight as you can. I'm going to flash a light and you tell me when the light flashes. So you say yes when the light flashes, okay? But the trick is you've got to keep looking just about here for me. So, okay, look here. That's great. And tell me when the light flashes. That is perfect. Okay. So I'm going to cover up one eye. And if you have a look at the lesser chars, and if you can tell me the lowest line of letters that you can see to read. Yeah, excellent, good for you. And same with the other eye. Tell me what's the lowest line that you can see to read. Yeah, perfect, that's great. Okay, still looking just here at the bridge of my nose. I'm going to hold up both hands and I'd like you to tell me how many fingers you see me pointing up. Now, could be either hand, so I'm going to try and keep you guessing, okay? So if you can look at the bridge of my nose, keep your head nice and still, that's great. And tell me how many fingers you see. Perfect. So, nothing wrong with your cranial nerve number 2, your optic nerve. So we'll move on now to your ocular motor nerves. Now this covers nerves 3, 4, and 6, or should I say cranial nerves 3, 4, and 6. And these are the nerves that are responsible for moving your eyes right, left, up, down, also diagonally, and also they actually rotate as well, which not a lot of people know. So the superior, inferior, and radial recti muscles, and the inferior oblique as well, which is the one that's responsible for what they call the torsion of the eye. So, and also these nerves cause the pupil to either dilate or constrict. So what we'll do is first we'll just check the pupillary response to light. So if you can look at the bridge of my... Actually, no, if you can look straight ahead for me, somewhere in the distance, at no fixed point, just let your gaze go soft. Mm-hmm. Uh-huh. Yeah. That's fine. I'm just going to do the swinging light test. So again, this time look at the bridge of my nose. And again, if you can look into the distance for me. Mm-hmm. And I'm just going to place my hand just here and okay, good. All right, that's fine. So if you can look now at the light, at the end of the pen light, and keep looking at the light for me. Keep looking at the light. Keep looking, keep looking, keep looking. Yeah, perfect. That's great. Okay. So what we'll do next is we'll get you to follow the light. Now, again, you need for you to keep your head as straight as you can, and just with your eyes, if you can follow the light for me. So if you can look at the light, and just with your eyes, if you can follow the light for me. Yeah. Doing good. Keep looking at the light for me. Mm-hmm. All right, that's very good. No sign of muscle problems, moving your eyes, your pupils constrict well. No sign of Duane's retraction syndrome or anything, so your eyes are working very, very well. So that is oculomotor nerve, cranial nerves 3, 4, and 6. So next we'll move on to number 5, which is the trigeminal nerve. Now this is the nerve that's responsible for the sensations in your face. So what I'm going to do is I'll get you to close your eyes for me. That's great. And I'm going to just brush my hands along your forehead. Okay. Now tell me, does it feel the same on both sides? Just do that once more. Same on both sides? Good. Okay. We'll do your cheeks next. So again, close your eyes for me. That's great. Yeah, good. Same on both sides. Perfect. Okay, and we're going to do now the lower part of your face, which is around your mouth and jawline. So again, if you can close your eyes for me. Perfect. Good. And tell me if it feels the same on both sides. Yeah? Excellent. That's great. So, what we'll do next is I'll get you to close your eyes. Now, not just yet. Now, what I'm going to do is I'm going to put this up against your face. This is kind of a dullish end of a Sharpie here, not the business end, don't worry. And I'm going to press it against your face, and I'm also going to press this sharper, not sharp, but sharper object as well against your face. Now with your eyes closed, if you tell me whether you feel a sharp object or a dull object. Okay? Alright, good. So, eyes closed. Excellent. And tell me, sharp or dull? Sharp or dull? Yeah, good. And sharp or dull? Sharp or dull? Sharp or dull? Okay. Sharp or dull? Sharp or dull? Sharp or dull? Sharp or dull? And sharp or dull? Perfect. 110%. You're doing very well. So, okay, now we're going to move on to cranial nerve number 7, which is the nerve that innervates all the facial muscles that cause you to make your facial expressions. So this is my favorite part. Now, I'm going to get you to do some funny faces. So, if I get you to smile, like that, showing your teeth. Yeah, that's fine. Can you frown for me? Can you, like this? Yeah. That's good. All right, can you pout and push out your lip like you're a child and you've had a really big disappointment? Can you puff out your cheeks for me? Can you... Yeah. That's good. Now, what I want you to do next is if you can clench your teeth for me, like this, okay? And if you can keep your jaw clenched for me, okay, relax. Now, what I want you to do next is if you can open your mouth like that, look surprised, make your forehead wrinkle. Yeah, good. Now, if you can keep your mouth open and don't let me shut it. If you can fight against my hands. Yeah. Yeah, excellent, good. Okay, you can close your mouth now. Okay, so next, we're moving on to the vestibular cochlear nerve, which is the nerve that innervates your ears and your sense of hearing. So, what we'll do is, if I get you again to close your eyes for me, and I'm going to be making some sounds on either side of your head, and you tell me where the sound is, which side the sound is coming from. Okay? So, if you shut your eyes and tell me which side you hear the sound. Okay, I'm going to do both sides and tell me when the sound stops, when you no longer hear the sound anymore. So, okay, all gone? Yeah, that's good. All right, so tell me which side you hear the click. So again, eyes closed. Okay, good. I'm just going to whisper some numbers in your ears. So again, eyes closed for me, and all you need to do is to repeat back the numbers that I whisper. Okay, so eyes closed, and come this side first. 15, 50, 27. Okay, yeah, spot on, good. Okay, and on the other side, 26, 22, 94. Yes, excellent, good for you. Okay, so what we're going to do next is we're going to move on to cranial nerves 9, 10, and 12. Now we can test all of these together, but 9 and 12 primarily governs your tongue muscle, which is one big muscle. So what I'll get you to do is, if I get you to look at me and just stick your tongue out like that. Good. Can you waggle it from side to side? Yeah, that's good. All right, and if you can lift your tongue up from me like that to the roof of your mouth. Yeah, excellent. Good, that's fine. So what I'm going to do next is I'm going to check I'm sorry about this, I'm going to check your gag reflex. So if I get you to go like that, tongue out, and I'm just going to, it's a little uncomfortable, I'm so sorry, but I'm just going to pop this back down through the end of your throat. Yeah, okay, perfectly normal. That's good. Now if you can open your mouth for me and say ah, ah. Yeah, that's good. Your uvula at the back of your throat, that little fleshy thing that hangs down, that's raising symmetrically and looks perfectly fine. If it was deviated to one side, then we might have something to worry about, but you're good to go. Now, nerve number 10 governs your swallowing mechanism. So I'm going to put my hands just either side of your throat like this. And if you could take a big swallow for me, please. And again, one big swallow. Okay, good. And one more time, one big swallow. Okay, that is perfect. Good. All right, so last cranial nerve is cranial nerve number 11. Now, what this does is it governs the muscles in your neck that are responsible for your head turning up, down, side, left, of just turning your head basically. And also it innervates the top of your body here, the top of your torso. So what we'll do is I'll get you to turn your head this way for me. Good. And the other way. Excellent. If you can look up for me. Down. Perfect. And look at me again. Now what I want you to do is to turn your head to your left, but this time I'm going to put my hand up against the side of your head, and I want you to I want you to turn into my hand. I'm going to fight you. There you go. Fight it. Yeah, that's fine. Good, nice and strong. And we'll do the same on the other side. So if you turn into my hand. Yes, perfect, good. All right, I'm going to put my hands on top of your head. If you can lift your head up like this for me and fight my hands. Yeah, don't let me push you down. Good. All right, and if you can lower your head into my hands here. That's it, fight it. Okay, don't let me push it up. All right, perfect, good, that's fine. Okie doke. So if I get you now to shrug your shoulders up like that and then let them down. Okay, if you can do that again for me. Perfect, that's great. And what I'll get you to do this time is if you can cross one arm over your shoulder like this, good, and the other arm. And if you can just give yourself a squeeze, give yourself a hug. Yeah, and then let go. That's great. That is fine. So if you can hold your hands out like this for me now, as if you're holding a piece of wood or a board, and I'm going to try and push your hands down, and don't let me. Okay, so there you go. Good. Oof, nice and strong. That's great. Okay, that, my friend, is you done and dusted. Your cranial nerves are working perfectly well. So what we're going to do to finish up, I'm just going to give you a head massage, but I'm going to feel for any lumps, bumps, or anything unusual in the integrity of your scalp and your skull. So I'm just going to reach around the back like this and just give you just a feel. Okay, good. And I'm just going to feel the mastoid process just behind the ears. And the preauricular part of the front of your ears. Mm-hmm. Yeah, that's fine. Let me just rub along the brow here, just to iron out any tension that you might have felt, any apprehension that you had at the beginning of the test. There you go. That's great. Okay, so we will see you again in 6 months' time. If you have any issues between now and then, you know where to come. I'll see you again next time. Bye-bye.